Thank you so much, Joanne. It's a real privilege and a pleasure to be part of this discussion. Hi, Clifford. Hi, Mike, everyone. You know, we've had the good fortune of having partnered with Gilead around 2015 when the treatments for viral hepatitis came along. And through this unique model of access, together we were able to treat and cure over 100,000 patients in Pakistan in the first year and a half or 2 years. And we were also part of the pilot that, the first pilot that Gilead and MasterCard did in Pakistan, which was treating these patients of hepatitis C, merging health with the digital financial inclusion technology. And I think it's a potentially a very powerful combination when you marry financial inclusion with healthcare inclusion. For example, and I'd sort of like to throw this idea to Michael, that countries like Pakistan, which are under-resourced and have large expat populations that are, that form the diaspora that really helps these economies keep going, potentially can be tapped to provide healthcare funding to address these really, critical healthcare challenges that the government alone can't fix. So viral hepatitis is a classic example in this case. What the MasterCard pilot showed us in Pakistan is that you can very transparently track the entire patient journey from diagnosis to treatment to cure, and be able to demonstrate that to a potential funder of such a treatment. And when you have, say, the Pakistani Physicians of North America, which is a very large professional body, have a couple of thousand physicians who have done financially well in their lives and want to give back to their community, you could use this product to then help fund and demonstrate to these donors the benefits of their funding. I think this diaspora funding of healthcare could be a great way that this combination of health and technology like the MasterCard product could come together and create these new opportunities of improving health conditions, both for critical diseases, but also for primary healthcare, because for large parts of the developing world, the really underserved portion of the health conundrum is actually primary health. So as Clifford was saying, it's not just that you have disease like HIV or viral hepatitis. What happens when that same person who's cured of hepatitis tomorrow develops diabetes, uncontrolled diabetes, or heart disease? So the primary end is really where a large-scale intervention would have the most impact.